I'm going to demonstrate how you can perform an integrated neuromuscular inhibition technique to a patient who is having a Piriformis syndrome. So the first thing that you do is to ask the patient to lie prone, and then the treating therapist should be seated facing the side to be treated. So the next thing is to grasp the lower limb of the patient, abduct and flex the hip to about 60 to 90 degrees, and then flex the knee of the patient and rest it in your thigh. The next thing that you do is to locate the piriformis muscle and then palpate for my fascial trigger points along the fibers of the piriformis. So palpation can be done using a finger technique starting from the sacral base or using a thumb technique starting from the trochanteric attachment. So using either of the palpatory methods, once the most dominant trigger point is being determined, ischemic compression using a light pressure will then be applied on that dominant trigger point. And then the limb will be fine-tuned by either internally or externally rotating the hip to determine the most position of comfort for the patient. For example, I'm now taking the limb into an external rotation, and if that position is the most position of ease for the patient, you will then maintain the ischemic compression for like 20 to 60 seconds, depending on participant's response to pain. So after 20 seconds, and based on patient's response, if the pain has subsided, you then release the compression, but without breaking a contact. You then apply compression again until when the pain reduces very drastically. You then instruct the patient to move the limb away from the restriction barrier using like 20% of its maximum strength. So now move the limb away from the barrier. You can see that we are now creating an isometric contraction. That is a form of muscle energy technique. So this contraction will be sustained for like 7 to 10 seconds, after which you introduce radius reciprocal antagonist facilitation method, in which the participant moves the limb repetitively 20 times in 10 seconds, just contracting and relaxing. So that no actual movement takes place. Now, can you move your limb repetitively 20 times in 10 seconds? Great. Now you can see that the patient is moving the limb repetitively, just contracting and relaxing, contracting and relaxing. And the hip musculature too is activated. So after 20 contractions, you then stop. That makes a complete cycle of an integrated neuromuscular inhibition technique. Thank you.